There is amplified narrative on the need for communities to take the lead in the fight against HIV and AIDS. This is premised on the understanding that programs and initiatives perform better when driven by the most impacted communities. How is this playing out in Nigeria? This is where we beam our searchlight on this week's episode of Health Options. Thanks for joining us on the program. I am Rabi Abdullah. If you're just joining us, this is Health Options, the program that not only tracks government policies on health, but helps you with the information you need to make informed choices about your health. Our focus is on entrenching community-driven HIV and AIDS response, and I have with me in the studio to give us insights into how Nigeria is prioritizing this in the national response. The Director General of the National Agency for the Control of AIDS, Dr. Gambo Aliyu. It's good to have you on Health Options, Dr. Aliyu.
Thank you, Ravi. A pleasure to be here.
A lot of emphasis have shifted to the community on the need for the response on HIV and AIDS, but driven by the community. Can we start on that note? What exactly are we talking about in reference to this?
Thank you. Yes, we are putting emphasis on communities because people live and interact within communities, and as HIV response is cruising towards controlling the virus and making sure that we end AIDS by the year 2030, things that are coming out are clearly showing that there are laggards out there in the community that either don't have access to our services because they are out of reach, or they don't have access because of what has been hampering access for the last 40 years to HIV services that we've been fighting HIV, and that is stigma and discrimination. You cannot end AIDS without identifying people living with the virus and making sure they don't give the virus to other people. Also, that virus does not constitute health risks to them by making them sick or killing them. The only way we can get access to those people that we found difficult to access is to use community and community leadership. And that is why this World AIDS Day, we emphasize the use of community and community leadership to have access to community members that we have found very difficult to have access and that have been harboring HIV and have been given HIV to others. One, either they don't know they have HIV because they have never had HIV testing. Two, they may know they have HIV, but they are afraid to come forward and access treatment services. Three, they may have known they have HIV. They have started accessing treatment services, but they drop out of the treatment because of stigma and discrimination. These are issues that we want community leadership to help us address. Why? Because the people living with HIV are within us, and they will continue to give members of the community virus as long as they find it difficult to come forward and know they have HIV. They will continue to give members of community the virus as long as they have the virus and they find it difficult or they are reluctant to come forward and access our treatment services. It is going to be a win-win situation. The community leadership leading to ensure that members of the community are not stigmatized against those who have HIV, and also they are not discriminated against, and they are assisted to access services. And if we do that, then people living with HIV/AIDS will get the support and the comfort they needed. One, to work with us to help them achieve that level we have always been preaching, that make sure that the virus in you disappears. When we reach you, when the virus disappears, we reach a stage we call U equals to you. That means if the virus is not seen, the virus cannot be transmitted.
Okay, so we're talking about the past now. I remember that time it was when there was a lot of momentum, when the community was really involved, in the response. In those days, all hands were on deck. We had support groups, but over time, I don't know, correct me if I'm wrong, I've heard it even now that people saying that the response had become, over medicalized. What's your take on this?
The response is not over medicalized per se, but development that are coming along the way. Before, the access to treatment services we have now were limited. And also the capacity, of the treatment options we have to help us take us to where we are has not been discovered as we are discovering it more and more this time. Now we are getting to realize that with treatment, good treatment, we can actually end AIDS. Before, we never thought that perhaps probably this is possible. What we were thinking is getting HIV vaccine as we deal with every virus, get a preventative vaccine that will prevent people from having HIV infection, and that will be fine. But later it became obvious that the vaccine has been continued to become elusive. So without the vaccine coming and without option that will also serve as vaccines, the only option we have to end AIDS and make sure that HIV continue to be seen as every chronic disease. That's the same way we see hypertension, the same way we treat diabetics. People live with the virus, without the virus killing them, without the virus making them sick, and also without them giving other people the virus. The only way we can do that is using the medicines that are now available and also accessible. We have them all over the country.
Let's look at the aspect of, really preventing new infections now, which to me, is crucial. What exactly is on ground when when it comes to getting the community to take the lead? What are those programs on ground or strategies on ground now that point to that direction?
When you talk of adolescents and young persons, they are an important community that we have recently found way to engage with, especially using social media and using platforms that you find them, because the conventional media we use, the television, the print media, we realize that their attention is not much there. But you can actually have access to them by a platform that they feel comfortable with, and we're doing that. On the side of the mother-to-child transmission, I think this is one area that we have a renewed strategy going forward. Why I'm saying a renewed strategy, we've seen, and we are seeing other countries now eliminating mother-to-child transmission. They are not talking of prevention of mother-to-child transmission. They're actually eliminating, meaning no newborn babies are seen born with HIV. And I think this is something that we can do, and that is why you've seen this renewed action. Recently, the First Lady was in Victoria Falls, Zimbabwe, before our African meeting, which we call the ICASA, on HIV, which is biannual. And this was to emphasize, to collaborate with other First Ladies to provide leadership, in Africa on preventing and then eliminating mother-to-child transmission. And on this, you will see community action beginning in 2024. We've realized that over the last 4 years, we found more people living with HIV by living the traditional facilities where we sit and wait for people to come and access our services, to actually meet them at the community level, at the doorsteps of their houses. So we're going to have more activities beginning from 2024 at the community level, engaging with the community and providing access, especially to pregnant women. There should be no pregnancy or a pregnant couple that will carry pregnancy from beginning to the end without having access to HIV services. Every pregnancy must be tested for HIV. And to do this, we're not only limiting our services or our campaign, among the general public. No, we're looking at community gatekeepers. We are looking at traditional rulers, religious leaders, and political leaders to lead. And you will see collaboration between NACA and National Assembly in particular, where we will use political leaders, members of National Assembly, to give us access to their community and to lead us in their community in the campaign, because when it comes to campaign, we know there are professors there. When it comes to having message getting across to people, I think National Assembly can help us, as you said, amplify, and this one catapult our message, to the doorstep of their constituencies, to make sure that in each constituency, no pregnant woman, escape HIV testing, meaning no pregnant woman delivers a baby with HIV. The good thing is that once we identify a pregnant HIV mother, we have 100% success rate of preventing mother-to-child transmission. So if we do that, give us 2024, 2025, having access to community, in ways and manner that we have not had before, and having the religious, political, and traditional rulers, behind us, and getting this message across to their constituencies, to the members of their community, including the community that we work with day and night. And these are the key affected population. People that are getting HIV much faster and are giving HIV much faster to others, are also involved in this campaign. We will have this campaign taken to community level, house door level, until we see that the entire country is saturated with this message. No baby should be born with HIV. And once we have this campaign taken to the grassroots and people get it and people start demanding for HIV services, I guarantee you Nigeria can eliminate mother-to-child transmission.
Okay. I know of a family. I got to know the mother in the course of my job. Her unborn baby, got infected. She was born with the virus, and years later, she's now a full adult. And the other day, I got a call from her. We had a conversation, and she said, "Auntie Rabi, I and my mom are more or less like on zero virus, that they cannot transmit the virus to anyone, the stage that they are." Can you educate Nigerians on this? What's this all about?
Inability to transmit virus means that the virus is not seen in the blood. Once the virus is not seen in the blood, the virus cannot be transmitted. And this is a very, very important stage to make sure that the virus is controlled. We can only control HIV within our communities and also within our nation or across our nation if we get people living with the virus and we make sure the virus is controlled within them. How do we control virus within individual? We control the virus within individual by making sure we make the virus to disappear from the blood. If the virus is not seen in the blood, the virus cannot be transmitted. And that is why we're emphasizing the gateway to accessing our services nationwide is through testing. You need to know your status first. Demand for these services is available across all our centers in the country. And if you want more information, you can actually call our call center at NACA, 6222. We will give you information where to access our services and how to get yourself tested. Everyone should have him or herself tested at least once in your lifetime. Depending on your level of risk, you may require testing every 3 or 6 months. It doesn't take much from the beginning of treatment initiation to get the virus fully suppressed. These tests, we repeat them every six months. And then by the time somebody is initiated, we're hoping they take the medication and they take the medication the way they are prescribed. After 6 months, there should be significant progress, in achieving that viral suppression. And within 1 year, that viral should be suppressed.
Let's talk about the pre- and post-exposure prophylaxis. Now, I'm asking you this question because of the increasing incidences of rape in our society. We're talking about community engagement. We're talking about the community taking the lead now. How aware are the communities of this intervention?
The key communities that are targeted for pre-exposure prophylaxis are aware, and we're creating more awareness among them. Who are the key communities? We're talking about people that are at greater risk of acquiring HIV. We know if you have people that have sex, men who have sex with men, and those who inject drugs, and female sex workers that are HIV negative, and you follow them over a period of time, as long as they take that risk and there is no protection, the tendency of them coming with HIV before the year ends, is high. And because of that, we make these services available to them. These are drugs that can be used by someone who does not have HIV, but is at risk of acquiring HIV, to make sure that HIV does not settle in to cause infection. When they are utilized, they prevent the HIV infection from happening, even when risks are taken and even when there are no protection. So this is where the pre-exposure prophylaxis campaign concentrates at this time, and also discordant couple. Discordant couples are a couple where one person, either the husband is HIV positive and the wife is HIV negative, or the reverse, where the wife is positive and the husband is negative. The essence of this drug is to prevent the other partner that doesn't have HIV from having HIV. These are the two areas at the moment where we campaign and provide pre-exposure prophylaxis.
Okay. Earlier on, you made reference to the National Assembly, talking about leadership now. If the community need to really take the lead, in the response, what sort of support should we be looking out for in terms of political commitment from the National Assembly and other key players?
National Assembly is poised to provide support in various fronts. One, they want to partner with us, and they want to be with us in the community. They want to participate in the campaign at the community level, at the grassroots level. And at the same time, they want to see how funds can be made available, to provide testing services at community level, so that access to the gateway, which is the test that somebody identifies or somebody get to know their status, whether they have the virus or they don't have, is accessible in various communities and available, even in the hard-to-reach area, especially in villages and remote places. These services will be provided. So we're working with National Assembly to make sure that there are enough funds for us to get these testing services across the various communities, various constituencies, senatorial and federal constituencies. And then we have the leadership of the National Assembly, the members and the senators, helping us creating this awareness within their communities, emphasizing the need to make sure that pregnant mother, at least pregnant mother, are tested for HIV services, and HIV is not allowed to be transmitted to the newborn babies within our communities.
Okay. On a final note, Dr. Aliyu, let's look at the 2030 target of elimination. How are we faring in comparison with other countries?
The rate limiting step of arriving at 95 target is identifying people living with the virus within communities and overall in the country. There are countries now that have achieved 95, 95, 95. However, if you look at their population and you compare with the population of Nigeria, you find out those countries do not have 1/10 of Nigeria's population. However, at the same time, you see, Nigeria has made remarkable progress. It made remarkable progress in the last 4 years. We remember around 2018, 2019, when we did the survey, the last survey we did on HIV across the country. And then after the survey, we discovered that the number of people that we have identified and are on treatment were about 800,000 plus. Today, as I'm talking to you, because of our ability to get out and to reach people in various communities and to take these services to communities where we feel and we saw after the survey that the shoes are pinching the most, people have accessed those services, and we've identified in addition, another 800,000 over this last period, last 4 years, that have HIV in our various communities and now are taking treatment, which is very remarkable. If you compare the campaign we have had all along, until 2018, 2019, stigma and discrimination has come in between us and identifying these people. We were only able to identify 800,000. Now, within the last 4 years, we were able to identify 100% of the number we have identified up until 2018, 2019. It shows we have made remarkable progress in fighting stigma and discrimination. In our communities, we have made remarkable progress in taking these testing treatment services to the doorstep of people across our communities all over the country. And we have had remarkable progress in creating this awareness. People now feeling comfortable to come forward and demand for HIV services and have their status known, and then accessing our treatment services. What we want to see in the next 1 to 2 years is more of these services, more of this access, and by the year 2025, we're very hopeful that we will arrive at the 95 target, UNAIDS target, before 2030. So from now to 2025, our target is to see Nigeria arriving the same boast of like very few countries in the world now that have attained 95, yet with population that is only 1/10 or 1/20 of Nigeria's population. With our population about 200 million, we're very hopeful that among our peers that have this population, we should be among the first one to arrive at 95 by the year 2025.
Okay, so, and I guess we are equally making plans ahead towards sustainability if we eventually get there, I guess.
Yes, and this is one area that I think we are ahead of virtually every country. I haven't seen any country in the world that have started this discussion about sustainability beyond 2030 like Nigeria has done. The last 2 years, we've worked with our development partners with United Nations to see how do we engage each other, and we have one national response, which is what we are having now. And if we have one national response, how do we promote integration? How do we promote ownership? How do we put the states in the driver's seat so that this program is owned by states and the program is monitored and implemented by states? And the state now give us these numbers and give us information about the status of the various states, and taking leadership and being responsive and responsible, towards 2030, because beyond 2030, states will be required, to lead and also own their individual responses. In Nigeria, we are starting this very early. Next year, 2024, we will see a program where states are gradually now being given the leadership. We will give them support. This support include financial, include technical assistance for them to implement their program and to feel comfortable implementing the program, as against what we have now, where we have the program implemented largely by development partners. Going forward from 2024, the program will now be gradually taken over by states, and states will be required to implement What we will want to see is the state implementing, and we are seeing the same result as we are seeing with development partners. With our population, with our ability and capacity, to achieve epidemic control and to provide sustainable structures, for sustaining the control beyond 2030. As I'm talking, I'm telling you, global community, and especially the American government, the Global Fund, leaders in Washington and Geneva are happy with Nigeria because of the bold steps we have taken, and because of the direction we are moving. And we want to move in this direction, and we want to ensure that this works for Nigeria, and this works beyond 2030.
Okay, I think, I hope other Nigerians are keeping their fingers crossed like I am towards that destination. So on that note, I would like to say thank you, Dr. Gambo Aliyu, for joining us on Health Options for this interesting conversation. Thank you so much.
My pleasure, Ravi.
That does it on the program. A quick reminder that you can go to our YouTube channel to watch the upload of this and other episodes of the program. My name is Rabi Abdullah. Many thanks for watching. Be good and stay safe.